Hello everyone, I'm Dr. Spinach, and for those who do not know me, I am an international medical graduate, completed my OET exam, PLAB exams, got my GMC registration. Currently, I am a second year psychiatry trainee. This video is all about PLAB 2 preparation plan. And this video is for anyone whose exam is only 2 to 3 months away from today. This video is also for anyone who has not started their exam preparation yet, or who is only at their beginner's level of preparation, where they have not done much about their PLAB 2 exam. This video gives you a complete PLAB 2 preparation plan from day 1 to day 60, when day 61 is your exam, and a guidance session with a doctor who subscribed to my guidance session as well as my PLAB 2 preparation boon course. Let's get started. So let's start with this. So your exam is on 3rd of October, and we have just 2 months for the preparation. Your level of preparation is beginners. You have watched some videos, but still you told me that you've only done history taking, psychiatry, and some counseling stations, right? Or not at all?
No, I
Nothing.
haven't done counseling. I
All
haven't done counseling. Yeah, and in psychiatry, I have read some only a topic of depression.
All right. Okay. So what we'll do here is we will go through the complete preparation that is required, and then I will
Okay.
give you how you can prepare and how many days that you can give to these. All right. So
Okay.
because we are at a beginner's level, I would
Yes.
recommend you to please give most of your time to this. So,
Okay.
I'm not sure how does your day go. Do you have most free time when in your schedule?
Yes, I have free
All,
time.
all right. So you can dedicate it fully here, right?
Yes.
All right, wonderful. So, okay, so resources that you're using a video course that is an offline video course, right?
Yeah.
Or are you taking live classes as well?
No, I'm not taking live classes. It is a subscription from Samsung Academy.
Okay,
So they have
so
their Genius class access.
all right,
So
all
I
right.
have taken the subscription.
Okay, so you have taken a subscription of video course from Samsung and you are doing more Sobi notes, right?
Yes.
All right, so we have these two here. Now, see, I feel both of these things are good. All right, Mosobi notes are good. Video course, well, I don't know. Well, I have not taken any of that, but I feel these are good. Now, what we
Yeah.
have to do here is we have to make a strategy, that is to prepare our own notes within this time frame. Within that is
Okay.
1 month. Now, see,
Okay.
you can be dependent on their notes, but preparing your own notes gives you a sense of uniqueness to yourself. Like, this is how I'm
Okay.
going to take the station forward. I
Okay.
so I will send you this this Word document, but I would ask you to make the notes yourself as well, if that is fine.
Okay.
All right.
Yeah.
Okay.
Okay.
So, yeah, what is the outcome of this? I did it for myself as well. It easy revision in the last days of your exam, and plus you
Mm.
have, when you're practicing, you can go back to these notes. What did you miss? I will share an example of these notes as well, which I have. When
Okay.
we'll do this, yeah, I'll share an example of this note. Also, when
Okay.
we will do the sessions, you will be able to understand what I am trying to tell you. Like, how should you prepare your notes?
Okay.
All right. Okay. So,
Yeah.
yeah. So now, starting with your preparation, the first thing that we need to know is to know the syllabus. What types of
Okay.
stations and how many types of stations are asked in PLAB 2?
Okay.
Right. So this include
Yes.
history taking, psychiatry, counseling, ethics, colleagues, teaching, prescription stations, examination mannequins and procedures, and Simmons stations.
Okay.
All right. Now,
Yes.
uh, now, so see, I have written everything very grossly. So whatever
Mm.
I could find, and whatever I remember, I have read, and also from the notes that I have already. So there is
Okay.
a possibility that one or two types of stations under these stations might be missing. So these
Mm.
are like a gross overview of all the stations. So history taking, you said that you have completed most of it. So in medicine, history
Yeah.
taking, we have cardiovascular, respiratory, gastro, neurology. We have ophel, ENT, OBGY,
Yeah.
pediatrics, dermatology, and surgery. All right. And
Yes.
oncology,
Okay.
endocrinology, rheumatology, very small, small substation. Now, each of
Okay.
these stations have around 2 to 5 stations in them. So the
Okay.
types, so within history taking, we have these stations, and within these stations, we have 2 to 5 types of stations as well.
Okay.
So, for example,
Okay.
yeah, I mean, going into example would be when you have already read it, so it's fine. You get my point, right?
Okay.
Okay.
Yes.
Now, psychiatry. Major stations in psychiatry include depression, bulimia nervosa, anorexia nervosa is also there, but I have seen
Okay.
that is asked less compared to bulimia nervosa. Then
Okay.
psychosis, suicide, insomnia, drug dependency, mini mental state examination, and dementia. So these are some of the
Okay.
major psychiatry stations that we need to focus on.
Okay.
Right? We have counseling
Yes.
stations. Now, counseling stations include counseling of a disease, counseling of a procedure, counseling after the results have been obtained. For example, someone comes out HIV positive, someone has another STI or a thalassemia diagnosis. So you're going to counsel them in their case.
Okay.
Pre surgery counseling, that what will happen in the surgery, post surgery counseling, if something have happened now, how to go about that and how these things will be resolved. So other than that, counseling stations also include combined stations with ethics. So for example, TTR, the full form of which is talk to relatives. So
Yeah.
talking to relatives, counseling station,
Yeah.
sorry, ethics station combines the counseling part as well.
Okay.
All right. So now,
Yes.
so counseling station is an overlap between history stations and ethics station.
Okay.
Okay. Now, coming on to the ethics stations, we have different types. That is breaking bad news, do not attempt resuscitation, treatment refusal, talk to relatives, confidentiality issues, domestic violence, which includes both child, well, all three, child, elderly, and adult. In child, we usually see non-accidental injuries.
Okay.
And then we have elderly and adult domestic violence cases as well. We have angry
Mm.
patients and angry relatives. We have medical errors. We have sick notes. So these are the
Okay.
major ethics stations. There might be more, but these are the major ones that
Okay.
come under ethics, right? Now
Okay.
we have colleague stations. Alcohol, cocaine colleague, coming late, confidentiality issues, angry
Mm.
patient to late discharge or cannula, not
Change.
changing, yeah, cannula change. So all of these will come under colleague stations.
Okay.
So these colleague stations are again combination stations of ethics and counseling.
Okay.
All right. Now we have teaching
Yeah.
stations. These will include ECG, urine dipstick, EpiPen, spacer, subcutaneous injections, ABG teaching per speculum, that is cervical spear, and BLS. Most of the major stations of the teaching.
Okay. Okay.
Okay. Then prescription stations, there are around 8 to 9 prescription stations that you have to focus on and that you have to
Okay.
practice.
Okay.
You will find them in your notes mostly.
Okay.
Then we have examination, mannequins, and procedures. So procedures include blood sampling. Well,
Mm.
normal blood sampling. We have blood culture sampling, which is little different from normal blood sampling. We have IV
Okay.
cannulation and catheterization. Most of the major
Okay.
procedure stations. Then
Okay.
examination in stations include abdominal examination, breast examination, testicular examination, antenatal examination. There are others as well, but these are the major and important ones.
Okay.
Right? We have Simmons patients. These include anaphylaxis, asthma, hematemesis, PPH. We have acute limb ischemia, comatose patients, septic shock. Septic shock can be due to urinary infection, pneumonia, or other cause, and post cesarean section pain management. So these will come under Simmons stations.
Okay.
Right. So now
Yeah.
we know that this is our syllabus. This is our complete syllabus of PLAB 2. Now what we have to do is divide the time for 2 months. So how
Yeah.
we have divided the time is uh, in 1 month, we have to finish all of these stations, no matter what. This will include,
Okay.
yeah, this will
Okay.
include you doing the videos, reading them, reading the notes, and doing the self note, making your self notes as well. plus
Okay.
practice with your acquaintances, whoever you meet
Okay.
at your academy or online. All right.
Okay.
So
Yeah.
division of time will be you will have a reading time. So we'll divide this into three slots. This preparation. The first will be when you are raw with your preparation, completely raw. So
Yeah.
that I have named as reading time. That you are first only for the first time reading this. Then we have revision time. That means
Okay.
now you are revising these stations, and then
Okay.
we have another revision time where we have started with mocks, exam
Okay.
oriented mocks. All right.
Yeah.
Now, all of this 2 months should be paralleled with practicing because PLAB 2 is all about role plays. It is not
Okay.
about reading and memorizing stuff. So, what is important here is to practice, practice, practice.
Okay.
All right. Okay.
Yeah.
Okay. Now, let's move on to the division of the time. So, I have divided time according to the days that may be required for these stations. All right.
Okay.
And I have also made a list. You can see this is flexible. So for you, it is flexible. So it is up to you how you want to do it. But how I have divided, I will let you know. So for the psychiatry stations, we are only going to give 3 days. Not many stations.
Okay.
Why 3 days? Because no matter what, one psychiatry station is asked in the exam. So what
Yeah.
we have
Okay.
to do is we have to perfect these stations.
Okay.
All right. So psychiatry
Yes.
since 3 days. So starting from the 2nd of August, second, third, and fourth, you can give, and then
Okay.
we can have a session on the 4th of August in the evening.
Okay.
You have completed them. So you start with your psychiatry right now. So this, what we'll do is we'll take a 2 hour session. So two sessions in one go. Why? Because not just do one station. We'll do at least two stations, and if time suffice, then we'll do three stations as well.
Oh.
All
Okay.
right. So
Only.
this, yeah,
Yes.
yeah. So with the feedback, so whatever I give you feedback in the first station, that you will take forward in the second station, and from that will you will
Okay.
take forward in the third station. If not, we'll
Okay.
do two stations. That is for sure. But then that time also I'll tell you that you make notes of all these things and revise them after the class.
Okay.
All right. Okay. Next
Yes.
is history stations. So again, because you have already done history stations, it is on to you whether you want to give 2 days time or 3 days time. So you can, however well you can finish. So normally, if I was doing it for the first time, I would give 3 days time because they are not very important. They are important. Definitely one or two history stations will come in the exam, but the syllabus to history stations is very much.
Yeah.
You got
Yes. The syllabus is very much, but
yeah. And they only
yeah.
ask one or two history stations. So you can give 3 days time for all of these history stations. You have already read them. You can read the new ones and revise the ones that you have already done.
Okay.
All right. So you can give
Yes.
3 days here. So now the next one would be why I would suggest you to go with the prescription is because you have already done a lot of reading. It is better to do something else so that
Mm.
you give yourself buffer, taking yourself back to the
Okay.
other stations that are more of a reading stations. All
Okay.
right. So upon again, it is up to you. You can change however you like. So prescription stations, 2 days are enough. Uh, what
Okay.
I would suggest in the prescription stations is to practice these stations very well.
Okay.
So once you have read how to do the prescription stations, so there will be like videos for prescription stations as well. But I would suggest you. I have made two videos of the prescription stations. Have you watched them?
No. No. I'll.
Okay.
I'll see
Okay,
that.
I'll share them with you.
Okay.
They are pretty
Okay.
good, I would say. So watch them as
Okay.
well.
I'll.
Watch your video course as well, and start with the prescription station. Now, prescription station is only going to be perfected if you practice them. So
Okay.
everything comes with practice, but prescription, again, you have to practice. And sometimes you have to even memorize, even if you have a BNF there. Still,
Okay.
you will have to memorize things. Okay, so 2 days are it.
Okay.
And practice,
Yeah.
I practiced around you won't believe, but I practiced one prescription station around, well, I would say 4 to 5 times at least.
Oh,
Yeah.
okay.
So that much amount of time you have to
Mm,
give. So
okay.
now the next thing that we can go forward with is, well, you have ethics. Now we are okay. Now we come back to ethics stations, for which we are going to give 6 days, because ethics stations are big stations, like too many stations,
Yes.
and
Yeah.
also very, very important stations.
Okay.
Yeah, very important stations. So these stations, you can think of 2 stations to come in the exam at least.
Okay.
Yeah. So that is
Yeah.
why we are going to give 6 days. And in those 6 days, you'll have to cover all of these. All right. Now,
Okay.
for ethics stations, you can give 10 to 15th, because
Okay.
I am busy with other things during this time. So I won't be taking your sessions from 7th to 19th. From 20th, we'll start
Okay.
back again. All right.
Okay. Okay.
All right. The next one,
Yes.
colleague stations, sorry, counseling stations. So after ethics, you can do counseling, because they are more or less a little same, not exactly same. So when you do ethics and counseling like together, you'll understand like, okay, so I can go about ethics stations using this counseling as well. I can go about counseling
Okay.
stations using this. So these are a little matching stations. That's why.
Okay.
So you have 16 to 21st, 6 days, and we can have, for counseling session, we can have a 2 hour session. But this
Okay.
date is tentative. 20th or 21st, we'll decide. Why?
Okay.
Because again, for this, uh, 1, 2 stations together, 2 to 3 stations together would be good,
Okay.
right?
Yeah.
Then you can go about, so 21st and 22nd colleague stations, do one day is for enough for colleague station, 2 days enough for teaching stations, 23rd and 24th. You have 2 days for examination and mannequin, and 27, 28 Simmons station. You have remaining 2 days, these are the buffer days, to complete anything you might have left from the any of the 9 stations. All
Okay.
right. Also to take the
Yeah.
breaks, because you cannot study, like that. So you'll just burn yourself.
Okay.
You'll have a burnout.
Yes.
Take some break as well
Oh,
there.
okay.
Now we have total 12 sessions, and for PLAB 2, we have 10 sessions, which we'll divide accordingly, and one more
Okay.
guidance session. Now, after this is complete, what I would suggest you to, from 1st to 15th September, but you have to make sure, if you follow this rigidly, well and good. I would suggest you to follow
Okay.
this rigidly. All right.
Okay.
And in
Yeah.
between these, so from 21st to whatever, like September, in between that, we'll try to complete all these sessions, and we can have a guidance session later if you want,
Okay.
or before, doesn't matter. If we have
Okay.
still a session left, we can do random, a random practice in that session. But mostly, we
Okay.
do not have a lot of sessions left, because we will try to focus on having the best, having the best outcome for all of these 9 stations.
Okay.
Yeah. So, yeah,
Oh,
the next thing is, from 1st to 15th of September, start practicing all the stations. So, okay, until now, do you have any doubts for me?
the examination mannequin and Simon. So I have to read this, or is it like I have to, because it is an examination? I
Hmm.
have to practice on. Is
Yes,
it like I have to practice on something in
yes.
academy, or just I have to read it with
No,
myself?
no, no, no,
What
no,
is
no,
the
no. Practice, practice, practice. So you have to read it first, whatever notes you have and whatever video course you have, look and
okay?
read. On YouTube, there are many, many good videos. I'll share the links with you. Like I remember
Okay.
I used to watch, it's a very famous one, Oski videos from, I forgot the name of that YouTuber, but that is
Okay.
there. Then you have many, many academies making videos for these as well. So watch
Okay.
them as well.
Yeah, I have this in the subscription, in the Samsung subscription. They have these videos. So, but
All
I
right.
was okay. So I will give read to them, and I will also watch the videos in these
Yes,
2 days for the examination and Simon. Okay.
yes, but not just that. Do you have access to practicing these examination mannequin and Simon?
Yeah, I have, but I was thinking like I would go to the academy in September, from 1st of September.
All right. Okay, that is
Like
also
uh,
fine. That is also
uh,
fine. At least have,
this.
you should, yeah, at least have a read to all of these things. That is fine.
Okay.
Okay, that
Yeah.
is also, yeah. So, okay, 2 days and 2 days, enough. But if you're
Okay.
giving these 2 days, then you have to be very, you have to have a very good grasp on these, not just reading
Okay.
them. So
Okay. Yeah.
also
Yeah.
practice it with someone.
I'll practice if it is an like abdominal examination or say
Yeah.
thyroid examination. So it could be done on anyone at home even.
Yeah. Also, without anyone, if you're having like a video call or an audio call with someone, whoever acquaintance that you're practicing with, you can still like, maybe just show them that this is how I'll do. And then first I will start with
Okay.
the
Yeah.
right quadrant and then take it to the left
Yes.
side.
Yes.
So you can
Okay.
tell that to them that this is, and they can tell you that what steps did you miss as well.
Okay.
This is how I
Okay.
used to practice when I was like, I could not go to the academy, or
Okay.
I didn't have the access in the beginning.
Okay.
All right. Now, once you have finished this, make sure you finish everything by 1 month. First,
Mm.
first reading is complete. Now, from 1st to 15th September, start practicing religiously all the stations. Now, for example,
Okay.
on the 1st September, for example, you take 4 stations or 3 to 4 stations together and you read them,
Okay.
and then you go about practicing them with your mates,
Okay.
coaching mates.
Okay.
Okay, once you have completed all of them, you can start randomly practicing them. But when you are
Okay.
randomly practicing them, tick them. Okay, I have practiced this one randomly. I have practiced this one randomly. Because it should not be like, okay, you're getting stronger and stronger in counseling. You're getting stronger and
Mm.
stronger in teaching. But you're not very strong in ethics or psychiatry because you're not doing a lot of stations there. So you have to be a little aware about even about the random stations that you're doing so that you
Okay.
don't go behind the stations that are as well important for the exams.
Okay.
All right.
Yes.
So,
Like,
yeah, take the feedback, work on it, add on the notes, mark where you went wrong. So,
okay.
whatever notes that you will prepare, your self notes, and have just one copy for that. Take a pen or pencil, and I'll share with you like how I prepared my notes, and you'll get an idea of that.
Okay. Yeah.
Yeah.
Yes,
Okay.
I was thinking of like how to make notes. Like, is it about the management and like I have to write the management or the
I'll
DVs, the
Yeah.
defense dynamic.
Yeah,
So, what sort of?
everything, but very, very short. Everything you'll write everything, but very short in a way that you will understand in very short forms. That I'll share so you'll understand how to do it, and you can make
Yeah.
your own by that. Okay, don't copy mine
Okay.
because everyone is very unique, and you will be marked
Yes.
on your uniqueness, the way you
Okay.
want to. This will give you a help on how to prepare the notes.
Yes, because Mosobi has management like about every the management is so long.
Mm-hmm.
The Mosobi book. So
Mm-hmm.
one cannot remember all of that, and it has so much irrelevant in it. Maybe it is not an irrelevant, maybe, but like there's so much points that
Yeah.
it get mixed. So
Yeah.
maybe like
So
I'll
no,
make
you
notes for
will
it.
be able to understand that when we'll take sessions now, when I'll give you feedback on the stations, you'll be able to understand what is relevant and what
Okay.
is irrelevant as well. And when
Okay.
you're going to practice with someone, you will be able to understand that as well.
Okay.
Yeah. So
Yes.
in I think in every course they'll tell you the complete management, but what we have to give to the patient is something that
Yes.
we have to understand, and that will happen only by practice and getting a feedback on your practice.
Yeah.
Yeah.
Okay. And in this month, like in August, this whole like the division of course. So I'll be reading this, and I'll be also practicing daily with someone. Is it like in this month?
Yeah,
I'll be
you have
practicing
to.
with
Yes,
anyone.
yes, yes, you
Okay.
have to practice. So I would
Okay.
suggest like at least do 2 to 3 stations every day. Minimum of 2 stations
Okay.
of that one. Minimum of two
Okay.
stations.
Okay.
So if you are like, let's say, reading for 5 hours or 6 hours, then give at
Okay.
least 1 hour to practice. Very,
Okay.
very important. Because if you
Okay.
don't practice and I take your sessions, then you're just very raw to me. And
Yes.
if
Okay.
you're raw to me, I won't be able to give you feedback on very small
Okay.
mistakes. I
Yeah,
will
yeah.
bring you
And I
feedback, but
understand.
that will give you, that will give, consume lot of my time, lot of our
Okay.
time. So I would say
Okay.
that practice it. And once you have practiced, you will understand. They will give you feedback as well. So you'll understand where you have to correct. You will understand yourself. Okay, that's what I didn't remember.
Yeah.
Okay, that's what I didn't.
Yes. Yeah.
So, okay.
Okay.
Cool. Now, the next thing is from 1st to 15th September. Yeah, this is done. Now, 15 days before your exam, you have to start exam oriented mocks. That means, and I
Okay.
would recommend you to take at least two 16 station mocks, and that too under exam conditions. What do I mean
Okay.
by exam conditions is that means there are 16 cubicles that you are going to go
Okay.
through,
Okay.
right?
Okay.
So whatever
Yeah.
it is that you have subscribed to, it is up to you. So,
Okay.
but you have to do two exam under condition pressure mocks, right?
Okay.
And
Yes.
the first one you can do on the 16th or 17th of September, like in during that time.
Okay.
And because you will have sufficient time, you will have at least 15 to 17 days to work on your feedback.
Okay.
Right? And the second one you can take on 22nd or 23rd of September, however you like. Further work on
Okay.
the feedback. It is recommended that not to, matlab, from my side, it is recommended to not take any mock 5 to 7 days before your exam, at least five
Okay.
days. Because,
Okay.
like if you get feedback 5 days
Yeah.
before your exam, there is not much you can change about it. And
Okay.
it will
Yes.
create panic and more, like your self confidence, your self esteem will go down. So it is better
Okay.
to take something 7 days, 10 days before your exam so that you have enough time
Okay.
to work on it. But you have to keep
Okay.
practicing.
Okay.
Yeah. So
Yeah.
when you are on the last 3 days of your exam is on 3rd of October. So we have here 31st of August. We have August.
Yeah.
Yeah. Yeah.
Third, the first.
Yeah. 31st of August, 1st of October, 2nd of October. So
Yeah.
29th of August as well. So from 29th to 2nd or 1st
Okay.
of October, it is important for you to practice mannequins, procedures, and Siemens stations. Why?
Okay.
Because I have observed if you don't practice them 2 to 3 days before your exam, you tend to forget them. And as
Okay.
much as hands on practice you do on these mannequins and Siemens, that much fast you will be in your exam. And that much
Okay.
fast. I mean, the mannequins and Siemens stations should be reflex stations to you. At least mannequins
Okay.
procedure stations. You don't have to think
Mm-hmm.
taking a blood sample. It should be very
Okay.
reflex. So that you have to practice them that much. All right. So
Okay.
you'll get good time during your 1st to 16th September as well. You'll go to the academy. You'll read them and then you'll practice them with your acquaintances as well there, colleagues as well there.
Okay.
Right. So
Yeah.
this is important. Then um, yeah, on the day before your exam, I would suggest you to do just 1 to 2 hands-on stations, that is mannequin or Siemens stations. One mannequin, one Siemens station is just okay. And 1 to 2 practice stations. That's it. Not much then,
Okay.
not more than that. Do not overwhelm yourself by reading too much. No, don't do
Okay.
that because you have done a good job preparing from the last 2 months. So one day will not give you an extra thing. So you just have to
Yeah.
relax on that day. And by evening,
Okay. Yeah.
don't read anything. That's what I
Okay.
suggest. So we'll have a
Yeah.
conversation before the exam as well. Don't worry. Uh,
Okay.
yeah.
Okay.
So now, any questions for me?
Now, yeah, I'm like the for psychiatry 3 days are enough, but for the history taking, I'm like 5, 6, 7 days. It is only 3 days. And I haven't done peds. I haven't touched peds even
Mm-hmm.
before.
Mm-hmm.
I think that the days for history taking are so much less.
Okay. So what we can do, we have two buffer days here, right? So what we can do is
Yeah,
we can
just for history
extend it.
taking.
Yeah, we can extend it. So how many days do you need? 5 days here?
Maybe five. Like examination of mannequin. I like if I will study this, if I can manage the days, take the day out from it
You can
and
do
give to history taking.
Simon. in one day. That's
Yeah,
fine.
semen or
But
okay, yeah, semen or
examination and
exam.
mannequins, you may need. Okay, so it's on to you. You can just do it in half a
Oh,
day,
okay.
right?
I will buffer them. Like
Yeah,
American and semen, I will do it accordingly because
yeah,
history taking contains so much. And I was like throughout, I was so misguided that I was only focusing on this history taking chapters,
no.
topics.
So I'll tell you
Now
this.
I know that I was doing it wrong. I
Yeah,
was all the time I was studying this rheumatology and this tiredness and headache and falls and neuro. All the time I was sitting and I was doing this. And the
yeah.
psychiatry is important. I just missed them. So I will now focus on these.
So I'm marking stars on the important stations here. All right.
Yes.
So
Yes.
see,
Okay.
if I'm marking stars, so let's see, one teaching station is going
Okay.
to come. Usually it comes.
Yeah. Please.
One,
Yeah. Usually.
okay, colleague may or may not come. It is very, one teaching station will come. One counseling station is definitely going to come.
Yes.
One prescription station mostly coming.
Definitely.
One,
Mm,
definitely one mannequin or procedure station will be there.
will
And
be
one
there.
Simon
Okay.
will be there. So you can see,
Okay.
and one history station will be there. I'm not marking a star because there are a lot of history stations. So you
Yes.
cannot miss reading psychiatry, ethics, teaching, counseling, prescription, examination, and Simon. Especially
Okay.
because these are very high. What do you say? Like ethics is like a very huge subject, but it is
Yeah.
very high yielding subject.
Yeah.
So even if
Okay.
it is huge, psychiatry is very little. It's very little, but it is
Okay.
high yielding because one station comes from psychiatry. Teaching is little. It
Okay.
is a little one. So you can manage some half a day from psychiatry to here,
Okay.
half a
Yeah.
day teaching to here. Counseling is a bigger one, but it is important.
Okay.
Then
It
prescription
is
is a
important.
small station. So you can see psychiatry, teaching, prescription. These are very these don't have a lot of syllabus, but they will definitely come. One,
Okay.
it doesn't have a lot of syllabus. It doesn't have a lot of syllabus either,
Okay.
right?
So yeah.
So
Okay.
the yellow marked ones are the ones that don't have a lot of syllabus, but
Okay.
uh, if you read them, like it is important to read them and revise
Okay.
them.
Okay. Apart from it, do you suggest any other notes, like any other notes that you have read?
I think Mosobi is good. You can go with
Also,
that.
be as well.
Yeah, you
Okay.
can go with that.
Okay.
Yeah, good choice. So, other than that, as I said, make your own notes from. If you read video course from, do this. Mark that in Mosobi, whatever it is that you're reading from that, and then make your own note from Mosobi itself. Like, don't copy
Okay.
it
And
completely, but only the
okay.
important and relevant things that you don't want to miss in the station.
Okay.
All right. Any other questions?
Right. Yeah. Just please share the notes with me. Then I'll get an idea of it.
Yeah, sure. I'll do that. I'll share this Word document as well for you. Okay.
Okay. So our first session would be by first the next session. When
We
would be our
can
next session?
take on
Psychiatry.
4th of
Okay.
August. Is that okay?
Okay.
All
Yes,
right.
this is
So
okay.
these are the stations and plus any other station that you might be having. Read them thoroughly and
Okay.
then we can do the session.
Okay.
Right?
Then
Okay.
yeah.
Any other question for me?
No.
All right. Okay. Thank you very much. Then I'll see you on the 4th. If you have any doubts, you can message me.
Okay.
All right. Okay.
Okay.
Very much for watching this video until the end. Well, I am doing PLAB 2 sessions. Well, these include both one-to-one sessions as well as mocks. And if you are interested, well, you can connect with me on my Instagram, that is here at Dr__Spinach, Dr__Spinach. Or if you do not have the Instagram, email me here, drspinach21@gmail.com. If you're interested, do that. And apart from that, if you really like this video, please give it a thumbs up. That gives me a positive reinforcement. So please do that to make more videos like that. If you are new to this channel and have not subscribed, well, you will miss on really good updates and videos. So do that right now. Leave a comment on what you learned from this today. And if you liked it as well, please just leave a comment and share it with people who you think might benefit with it. So all the very best with your PLAB 2 exams. Well, you guys only have 2 to 3 months left before your exam, and it is very important that you use them very wisely without wasting your time, giving your full to this preparation. This exam is not cheap, and your time is not cheap. You have a limited time on the earth. You have limited, well, you can earn money, but again, nearly 1,000 pounds is not cheap money, and it's a hard-earned money. So, well, give your full time, give your quality time, and practice well and follow all the tips that were given in this video, and you will be good to go. Okay, then, bye. All the best.